Now we are going to see the structures that are posterior to the lens, which is a vitreous. See, it can be a case of an vitritis or a posterior vitritis or an endophthalmitis or a retinitis, right? Now we are going to the pathological conditions that takes place within the eye that is posterior to the lens, say the vitreous humor. Vitreous is affected, so vitritis happens, so they'll have to remove the entire vitreous and they'll have to give a substitute. It can be like silicone or a inert gel-like substance that can be injected. Or sometimes in order to treat conditions like endophthalmitis, right, they will have to inject the drugs like acyclovir, like chemical substances into the eye for the treatment of such infections. Vitrectomy. Now the doctor decides that he'll have to remove the entire vitreous humor. That's called vitrectomy. So normally they do a mechanical vitrectomy or via a pars planar approach.